Okay, first we want to go over what ideal photographs look like. This document we'll review can be found if you Google search ABO photos, and it's this one right here, Ideal Photographs and Radiographs. This is from the American Board of Orthodontics. So these are the perfect photos. So this shot, the side view of the extraoral photos, you want them to have their teeth together, their lips relaxed and in contact, just looking straight forward to the side basically. You want their hair to be pulled back behind their ear and for them to just be looking forward normally. And ideally you want a white or light colored background. The frontal extraoral photo, they just turn and look at the camera. You want the hair behind the ears, no distracting jewelry and eyewear, and for them to just be looking straight at you with their lips together, just normal, no smile. Second, you have them do that same shot, but you have them smile, and then you take a picture. Inside the mouth, this is the frontal intraoral. So you want the occlusal plane should be horizontal and bisecting the photograph. The occlusal plane is the plane that the biting surfaces of the teeth make. And you want equal display of the left and right posterior dentition. So you achieve this by taking the photo directly from the front. So not with their head slightly turned to the left or right, but with them looking straight at you, so you get equal amounts of the posterior teeth on the left and the right. And you want their teeth in occlusion, normal posterior occlusion, not some crazy occlusion that kids do when you say bite down. The lateral intraoral, you want to show all of the teeth, but you want to be as far to the side as you can. In other words, not this shot, but them slightly turned to the side. You want them completely from the side so that their back teeth are flat in front of you. And you want to show ideally all of the first molar right here, and you want to show the opposite anterior central incisor here. And you want to be in the occlusal plane, so not taking it from above or beneath, but flat on with that occlusal plane. And then same thing for the other side. The intraoral maxillary photo, you want this mid-palatal raphe, which is the line along the midline of the roof of the mouth, you want that centered in the shot, and you want to show equal amounts of buccal surface on left and right. So you achieve this by them, again, looking straight at you on center. So you're not taking the picture facing from the slightly to the left or slightly to the right, but exactly centered. And that'll show equal amounts of buccal on the posterior teeth, and then kind of down the incisal edge on the anterior. And you need the lip to be out of the way, so the lip is not over the incisal edges of the teeth. And ideally you want to capture 7 to 7, so the second molar to second molar all the way to the incisors. And then same thing on the lower, you want it centered, equal amounts of the buccal left and right. You want to be looking right down these incisal edges, and you want their tongue out of the way. So you can either do this by having them hold their tongue down, which is very difficult, or I'll have them lift their tongue and touch the roof of the mouth, and then I'll just, with the mirror, push the tongue to the back of the mouth, and so it's completely out of the shot. And you want to catch 7 to 7. So the final result of those photos should be these here. We'll go over how to crop them in the software in another video, but this is ideally the shots that you want to take. It's very, very important while you're taking these shots that the person be biting down correctly. So most people who are class 2 and their lower jaw will be back, they'll want to posture their teeth forward or do some other thing. To make sure that they're biting together correctly, I'll actually gently grab a hold like this, their chin button, and I'll just kind of gently wiggle it and have them move it back gently, gently, gently until they slide back and bite into their class 2 occlusion. You'll know that they're biting correctly if all of the teeth are touching together. If like a couple of their teeth are touching and the rest are open, they're probably not biting together in their natural bite. So you want to move them around and encourage them to bite down, and you'll see all of their teeth come together, and that's how you're pretty sure that that's a good natural bite for them. Okay, so we're going to take your photos. Go ahead and stand right here in front of this thing, centered up there, yep. And then this first one's no smile at all, just look straight at me. Okay, now big smile, funniest joke you ever heard. Now turn that way and look straight at the wall. Perfect. Okay, so now we're going to take photos of the inside of your mouth. So first we're going to put this on, go ahead and open big. This will just slide right in here like this. And then go ahead and hold on way up here for me. Just hold it way up high like that. Rest your head back against here, turn toward me. There you go, raise that really big. And then open as wide as you can. I'm just going to slide this in here and open as wide, wide, wide as you can. Big, big, big. Okay, same thing. We're going to switch this over to do the lower lip. Just hold it right down like that by the end. And then open your mouth really big, kind of turn toward me a little bit, and raise your tongue up to the roof of your mouth. And open as wide as you can. Wide, 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 open, big, big, big. Perfect. Now I'm going to switch out for these. And go ahead and open. We're just going to slide these in here like this, one on each side. And go ahead and hold on to those for me. Turn straight toward me here. And bite together on your back teeth. Yep, just like that. Perfect. And then relax this one and pull back on this one. Kind of turn your head to your right here. Turn your head way over. Pull back hard, hard, hard on this one. Really hard. Bite together on your back teeth. Just bite all the way together. Perfect. Stay just like that. Excellent. Same thing but the other side. Relax this one. Turn way over this way. And pull back hard, hard, hard. Just like that. Just stay just like that. Perfect. Excellent. Okay, beautiful. So every photo should be taken with the flat plane of occlusion. So the plane of occlusion is the surface that if you were to bite on a card like this, that is the plane of occlusion. Like that plane that is on all the biting surfaces of the teeth. So when you're taking the side shot, you want the occlusal of this side to line up with the occlusal of that side. So not like this, like you're taking it from up above, or like this, like you're taking it from underneath. You want it nice and lined up, just like that. Only they won't have a card in their mouth. So it looks like this. From the front, you want it like that. So not taken from above like this, or from underneath like that, but straight on with a flat plane of occlusion. And you know in your viewfinder of your camera, because these back teeth and the front teeth are all on the same plane. They're lined up with one another. So you want all of your intraoral photos to be flat with the plane of occlusion and to be centered left to right, so the patient's looking straight at you and not slightly from the left or the right like this, or not slightly looking up or down. So the way that I achieve this in the chair is I'll have the patient rest their head back against the headrest and then turn toward me slightly, and then I will adjust my height to get exactly on that plane of occlusion. So it's very important that your photos be in focus. To make sure that they're in focus, this is what you want to do. You get your shot all set up so that when you're looking through the viewfinder, it's exactly how you want it. And then you push the button halfway down, you'll hear that beep, and whatever the little square that it lit up in there inside your viewfinder, that's what it's focused on. From when you push that button and it beeps to when you take the photo, you don't want to move anything, because when it beeps, that means that that thing it beeped on is in focus. So now if you move forward or back, that plane of focus moves with you. So if you get all set up and you focus it, and then you say, oh, move your little thing here, just take your finger off, get everything perfect, get reset up, focus, and then take the shot. Between when you focus it and when you take the shot, you don't move, the camera doesn't move, the patient doesn't move, nothing moves. If anything moves, just take your finger off and refocus and then take the shot. The second most important thing is inside the little viewfinder, you'll see some little squares or boxes like this. Now, whatever you focus on, one of those boxes is going to light up. Whatever thing it was over, when it lit up, that's what's in focus. So if it lights up over the cheek or the lip, then you want to take your finger off and refocus until it will light up over the teeth. That means that the teeth are now in focus, and then you take the shot. If you get those two things right, your shots will always be in focus. Okay, so this cheek retractor right here, or this lip retractor, you just have them open wide and you put it in kind of like an impression tray like this, and then you slide it right up here and have them raise it up. People want to do this, but that will not pull their lip back. So you have them hold it at the very end and lift it up high like that. And then on the lower, same thing, you put it in, you have them hold it down here at the very bottom and then hold it way down like this. So if they try to do it like that, it's not going to work. They have to hold it down like that. And then when you hold the mirror, you want to hold the mirror like this, not like this. This will get your thumbs and fingers in the shot. So you hold it like this for the lower, and you slide it in like that. And then for the upper, you switch it around and you hold it like, or for the lower, you switch it around. And then I'll have them put their tongue flat up, or touch the roof of their mouth with their tongue, and then I'll just slide their tongue back, and you hold the mirror like this. And the bigger they open, the better you can tip this up and the better shot you can get. Another way to hold the lip besides this, if you don't want to use this, that's fine. You can use these same cheek retractors that we use for taking the buccal shots, but go ahead and slide those into your mouth. You just have them slide those in, and then when you go to take this photo, they just have to pull up like this and open big, 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 and pull them apart really wide, pull them apart, and then you slide this in. I personally do not like this way. I think the fork works much better, but that's one way that you can also do it. You want the mirror that you're using to be warm so that it doesn't fog up in the patient's mouth. So you get it right off of the heating pad and you use it first. That's why I take my occlusal shots first, so that this is warm and does not fog up. If it gets cooled off, you can run it under some hot water for a while to heat it back up, and that will prevent your mirror from fogging up while you're taking photos. So when you're sliding the mirror into the mouth, you need to put the mirror distal to the most distal thing you want in the shot, because you'll see the reflection in the mirror is what you're going to capture. So if you only put it in like that, you'll only get the first molars. If you put it in like that, you'll only get the premolars. So you have to put the mirror distal to the most distal tooth like this. And then you angle the mirror so that you're looking straight down on the arch like this. So if they don't open enough and it's like that, you can't get a good shot. They have to open really nice and big, and then you get that mirror in there distal to the sevens and angle it so that you're looking at all the arch nice and centered. And then same thing on the lower. When you go to get the lower shot, you'll have them raise their tongue up. You'll slide this back like that, and you have to get the mirror distal to the most distal tooth like that. And then you get the right angle and the right shot. So they'll be kind of like that, and then bang, just like that.
Ain't nothing in this world that's stopping me. My Rari outruns your Odyssey.